Welcome to Success in Motion. Join us as we dive deep with top leaders, entrepreneurs, and professionals, uncovering strategies to grow, scale, and succeed.
Welcome back to the Success in Motion podcast. I'm your host, Alex Burho, and today we're going to be joined by Jenalyn Greenwood. And she is a pharmacist in the Coast Guard. So, Jenalyn, thank you so much for coming out and joining us today.
Thank you for having me.
Yeah. So, Jenalyn, can you just tell us a little bit about you, tell us about your background and what you do?
Sure. It is a little bit convoluted, but I am a pharmacist in the Coast Guard, as you said, but I came originally from the Indian Health Service, and a lot of people may not be aware, but there is a uniformed service known as the Public Health Service, and it is one of the 7 uniformed services that allows us to be stationed, if you will, into various services. So I started out with the Indian Health Service, frankly, because I had a lot of student loans and they offered loan repayment. So my first duty station was in Tuba City, Arizona, and then 3 years later, Sitka, Alaska. And that's where I learned about the opportunity to be a pharmacist in the Coast Guard and to transfer over laterally. So remain in the Public Health Service and just be stationed to the Coast Guard. The Coast Guard is a military service, so that's one thing that confuses a lot of people. Public Health Service is not military, it is uniform, but the Coast Guard is. So once I was stationed with the Coast Guard, they get to choose where you go. You have the typical military tours. The entire time I was wearing uniform, being in the Public Health Service, but when you get stationed to a service that has a different uniform, you adopt the uniform of that service. So I changed uniform from what would be the Navy uniform to the Coast Guard uniform, and had to learn a whole new set of policies, procedures, customs, courtesies. The customs and courtesies are typically similar, but just really aren't so much in practice, I would say, on the Indian reservation. And so there was a different culture.
Yeah, for sure. So sounds like you've had the journey from pharmacist to that public health service and then over into the Coast Guard. What kind of inspired you or what drew you to wanting to be in that public health service? Because like you said, not a whole lot of people know about that uniform capability.
Yeah, well, when I became a pharmacist, it was primarily driven by 2 parents that had diabetes and wanting to learn how to care for them, as well as prevent myself or other friends and family from going down the same path. And once I discovered that federal pharmacists were treated a lot differently with respect to autonomy, I wouldn't really say, entirely autonomous as mid-level practitioners, but something more like a physician assistant, where you work with a physician, you can have a specialty practice. I started out with an anticoagulation clinic where I saw patients and ordered their prescription and labs to monitor their prescriptions and adjusted therapy appropriately based on their labs. And to me, that felt right. That felt like, with all of the education that a pharmacist gets, a doctor in pharmacy, I really didn't want to just be stuck at a computer in a retail pharmacy, primarily dealing with insurance. It, to me, feels like a discredit to our education and career that corporations are really just pushing number of prescriptions rather than face-to-face interactions, patient care, uh, which I believe is where pharmacists should be, with trying to practice at the top of our education.
Mhm.
So yeah, that was exciting to me that oops, not moving enough. Is there still enough light?
Yep, we got enough light.
Okay. It was exciting to me to learn that federal pharmacists had more freedom with respect to not having to follow state laws and collaborative practice agreements that, as you move around the country, it could get very difficult. Federal pharmacists had more freedom within the policies of your agency.
So with that, as you've had a little more freedom, how do you think that has changed or affected how you practice as a pharmacist versus, maybe one of your peers who didn't go the federal route?
Yeah. Well, I feel uh, lucky also that I got in pharmacy when uh, it wasn't an expectation to do a residency. Now, if you want to do clinical pharmacy, you have to do a residency. So I went straight into clinical pharmacy, and I did have, just for the sake of comfort, I wrote out an agreement that I had a physician who oversaw my practice. But it really didn't have so many requirements to go through the state board of pharmacy or that sort of thing. It was just a camaraderie and collaboration with a coworker who happened to be a physician who agreed he didn't want to take on anticoagulation and was happy to let me do it.
Awesome. Well, that sounds like it's really cool that you're having a lot more of that autonomy and everything. So, going along with your story a little bit, so you're in that public health service for a while. What prompted the transition from that to specifically be with the Coast Guard?
Well, I would say um, a few different things. There was two individuals that I knew while stationed in Sitka, Alaska, that inspired me to switch over to the Coast Guard. Sitka, Alaska is on an island and there's not a whole lot of other industry there. So the Coast Guard being there, um, I appreciated the friends that I had in the Coast Guard. And unfortunately, both of these individuals passed away, but one of the individuals was a wife of a Coast Guard member, and she was a nurse that worked at the Native American hospital with me. And she had cancer, and unfortunately, it was terminal and metastatic at the time that they discovered it. And so I was impressed that the Coast Guard really just created such a good family environment for the Coast Guard member and his family in their time of need. Getting out of Alaska is no easy feat, and they moved him and her nearer to their family in Florida emergently and allowed him to uh, be with her on a flexible work schedule. And then another friend who was a helicopter mechanic. Unfortunately, their helicopter went down when they were taking a new helicopter from Astoria, Oregon to Sitka. And once again, seeing the Coast Guard community come to support his wife, it was just very impressive. And it stuck with me that this is rare. You don't see typically organizations that can rally around a family to support them in times of crises. And corporations, their goal is to make money. And obviously this is not making them money. It's a liability when your people are not able to work because of tragedies. But I wanted to work for an organization that did that.
Yeah. Well, I'm sorry about both of those. That's really hard and that's hard to go through. But I'm glad you've been able to find this community that really helps and supports in these hard times. Um, what other benefits or positive aspects have you seen in these close-knit communities?
Oh, it's really actually a good community for families. I mean, of course, in other ways, it's not because it's not good for you to be moving around the country all the time. But they always have, typically before COVID, I should say, they would have a back to school backpack and supplies that they would give. There's like breakfast with Santa. There's breakfast with the Easter Bunny, and a lot of activities for kids. There's like a teen center where they can go and meet each other and hang out. There's a movie theater on base that is either free or very cheap. And it just seems like an opportunity to make friends who are in your same category of moving around the country and need to make friends.
Absolutely. And again, it is so great to have that community. So, if someone listening would like to kind of follow down your path, they either want help with the student loans or want to kind of join this community, what tips or tricks would you give someone who's trying to go down either the public health service route or the Coast Guard route, specifically in pharmacy?
Well, you do have to meet physical fitness standards and health standards. So, just first and foremost, just not to burst anyone's bubble, but if you have anything that might prevent you from being deployable, this isn't going to work out for you. But if you seem otherwise healthy, ready to run a mile and a half, do push-ups, sit-ups, then there's a liaison for each of the agencies. And whether it be PHS or military, there's always an officer liaison, recruiter, I should say, that would be a good point of contact.
That's awesome. And now, what would you say has been some of the biggest challenges or struggles you've had just throughout your whole career in general?
Well, I obviously the moving is a challenge on families, on children, and I had a divorce while stationed in Massachusetts, and what was very frustrating to me is that our military is not better protected in divorces. And I will say that I don't know a solution, but basically you're subject to the laws that are the same for civilians of that state. So because I was in the military and moving to a new duty station, they saw that as a negative. Despite me being the primary breadwinner and, a loving mother that tucked my daughter into bed every night, I was shocked that they literally wrote down that my daughter would be better to stay with her father who just got a job because he's more stable. And despite, him not working for the 10 years of our marriage and, me being the stable one, it just happened to be geographically that I was moving.
Right.
And thankfully, I ended up getting custody of her and we moved to Florida together. But it was a very difficult time then. And as I fought for custody in Florida, there was one individual who was not supportive, that was not higher rank than me, but a pretty important position that I needed to collaborate with. And they seemed just not willing to work with me, that I needed to go back to Massachusetts for monthly court. And, so while I have this story of like, wow, the Coast Guard is great and it rallied to support these people, it really depends on the people, because the organization allows for that. But if you have someone who is influential who doesn't want to support you, then the support isn't going to be there. And so that was very difficult. And then I would say another very difficult situation, similar. I was diagnosed with breast cancer in 2022, and thankfully I'm on the other side. My MRIs and mammograms have all shown that I'm clear, and PET scans have shown that it hasn't metastasized. It's not as as easy as, oh, you're done with chemo and radiation, let's get you back to work. So again, it takes an individual who wants to support you, who understands that you might have chemo brain fog and, a variety of other things that make it difficult to just jump back into work after having been through so much. And so again, the capability of the Coast Guard is there, but if you have individuals who happen to be in your chain of command, or like I said, with this individual in Florida who isn't in the chain of command, isn't higher ranking, but they're very influential on people who are, it can make life terrible. And the whole reason that I joined the Coast Guard was for that support, and then to be in a situation knowing that it could be offered to me. And while I was going through chemo, everything was great. I did get the support. Radiation as well. It was wonderful. I will say there's one individual who did not. I would say they were tentatively supportive. Like I could tell, like this was going to be an issue, and it was. So as soon as I was done with radiation, things did not go well, and that has been extremely difficult. While I'm ongoing therapy, I'm considered active therapy because it's just not a chemotherapy, radiation, and you're done. I will be on active therapy for another 10 years.
Yeah.
And I'm not back to baseline. There's a whole new me to figure out, this whole new body that I've got to figure out.
Absolutely. It's very life-changing, and thank you again for sharing that. I appreciate that you were willing to be so open and vulnerable with us. As what lessons would you say you've learned as you've been having some of these different struggles? As again, sometimes you're getting the support you need, and sometimes it's been a little iffy. What have you done to really help either learn from it or be able to help take care of yourself?
Well, I've learned a lot of patience and yeah, and I need to be compassionate towards others, looking back at times where, maybe I was frustrated with my mom because she didn't get this technology thing, or, understand what I was saying and walk as fast or talk as fast or whatever, that like you really need to just slow down, and it's okay to slow down. Like
Mm-hmm.
even if you have 10 things that you need to get done that day and you only get through one, or maybe you get through none, just having compassion and being there for people. I mean, that's really the best that we can do in this world, is just be there for each other, just to,
Mhm.
yeah. the sun will come up another day, and there's always another day to get things done. But our health and our mental health is most important. And, I really appreciated, oddly, like if anybody's been in this situation, people who would just sit with me in silence, even, you don't have to say anything.
Mm-hmm. That's amazing. And thank you for sharing that. It really is so true. If you need patience, you need to take care of yourself physically and mentally. And the more you take care of yourself, the better you can show up as you move forward, too. So I know there have been some people who, when they go through hard times like that, they find themselves either unable to work or they have to change their situations. And so I know a lot of people are trying to create some form of passive income or things that can help supplement when they are going through times where they aren't able to work as much. Have you had any thoughts on this, or what have you done to try to help create some of that?
Yeah, well, I've kind of dabbled in the real estate, this thing called active duty passive income group.
Hmm.
I'm a big fan, but I don't think there's anything really that is passive. It's still active. Um, so my home in Florida, I rent out. I will be, renting out this home in California. Um, and whether I live in my Florida home again or I just continue renting these, I never intend to sell them. Um, and that gives me some income that I would say the work is more flexible. Like I can,
Yeah.
um, shift priorities to do the work when it's needed, but not being a 40-hour work week kind of thing.
Hmm. Just allow you to have a little more flexibility with being able to manage it. Love it.
Yeah.
So, as we're wrapping up this interview, what plans or initiatives do you have coming down the pipeline in the next 6 to 12 months? What are you going to be up to as we move forward?
Well, I would say the Coast Guard has been a very healthy population. So I left clinical pharmacy and went more towards being a regional executive, administrative duties. And in the next 6 months or so, I hope to dust off those clinical skills and get back up to being, again, potentially looking for a shift in career, maybe a retirement of the Coast Guard in a year and a half, and being more proficient clinically. I am board certified, and I have to maintain that, but there's a lot in pharmacy that is really difficult to keep up with.
Well, thank you so much, Jenalyn, for your time today and sharing again about your journey and what you've learned and how you've grown through it. If anyone listening today would like to connect more with you, what would be the best way to get a hold of you?
I would say either LinkedIn or my email, which is my first name, Jenalyn .greenwood@gmail.com. Just, if you reach out in LinkedIn, let me know a little bit about yourself, because I typically don't respond to people that I don't recognize their name or see that there's any social connection.
Absolutely. Well, again, thank you so much for your time and your thoughts today, and we will catch the listeners on the next episode.
Thank you.
Thanks for tuning into Success in Motion. Want to share your story? Visit successinmotionpodcast.com /guest to apply and be featured on the show.